I had surgery for a hernia in my groin. Is there a risk of the hernia coming back soon after surgery? Now, if you want to know why, stay there. I'm the doctor. Márcio Fernandes, general surgeon and head and neck surgeon. And this channel is intended for the world of surgery. And the first point that we're going to point out is the following. When we perform inguinal hernia surgery, it's that groin hernia surgery, the one I'm showing you. Necessarily, you have to use mesh. That mesh that we use to repair the hernia. And why do I say that? Depending on the type of hernia we are treating, the placement or not of mesh will depend on the size, a series of factors associated with both the patient and the hernia. But when it comes to inguinal hernia, groin hernia, you have to put a mesh. But as I've already explained in another video, the formation of the inguinal hernia is like this. A content that is inside the belly protrudes to the outside of the belly. And she chooses precisely this region that I'm showing you because it has a natural fragility, and when it becomes more fragile, more deficient, this wall creates a hernia and protrudes out. Consequently, the correction of this hernia is to take this content that is out, put it in, and correct this floor. Correct the floor and stitch these tissues together. Stitching these tissues together, that area was retained. But these stitches that have been given, they are not enough for a good hernia repair. This was done in the past, many decades ago, but we knew that when the hernia was corrected only by stitches, the chance of this hernia coming back was very high. It reached 30 to 35%. And then the hernia repair was created using the mesh. So even if that hernia may need to give some stitches, because many times there is no such need, over the place where the hernia repair was done, a mesh is placed on top. And this mesh will serve as scaffolding for the body. And this scaffold for the body allows the body to heal on top of this mesh and make this mesh create a toughness, that is, a fibrosis wall. And then that wall will indeed have full resistance to hold back any pressure that may come from inside the abdomen and thus prevent the hernia from returning. A very practical example that I often use: when they made those old concrete slabs, you placed that iron mesh, like an iron mesh, you put concrete on top and you waited for the concrete to dry, and then that slab had support. If you placed the concrete without that iron mesh, or you removed it right after you put the cement in, it would collapse. The principle of the mesh is exactly the same. So if you perform a surgery and right after the surgery that patient doesn't follow the recommendations for rest, starts to exert force, starts to do activities they were not supposed to do, the pressure inside the belly increases. The increased pressure inside the belly forces the surgery site and can consequently rupture the stitches, and that hernia can return even with mesh in that location. Why? Because there hasn't been enough time for the mesh to heal and do its real function, which is to create a fibrosis, which is a wall of fibrosis, and then there will be support. And that's why the patient needs to do that initial rest, which is to give the mesh time to adapt to the body. Did you understand? Well, if this video was helpful, consider subscribing to the channel. It's completely free. I benefit from your presence and you receive daily videos.